Tuberculosis and HIV, they're two of the deadliest infectious diseases on the planet, and for decades, we've known they're a lethal combination. But what if the very process of fighting one could unlock a powerful new way to fight the other? Today, we're breaking down a major study that investigates exactly that. Let's get right into it.
So here's the central question this research really forces us to ask. In our global fight against HIV, are we overlooking a powerful tool that's been right in front of our faces the entire time?
The core idea here is actually brilliantly simple. When someone gets diagnosed with tuberculosis, public health workers go out and trace their household contacts, basically the family and close friends living with them, to screen them for TB too. This study asks a simple question. What if, during that same visit, we also offered an HIV test? It's a strategy designed to fight this deadly duo with a single targeted strike.
Okay, so why was this research even necessary? To really get that, we need to take a look at the existing guidelines and the evidence, or maybe the lack of evidence, that was propping them up.
Now, what's really interesting is that the World Health Organization already recommends doing this. But here's the problem. That recommendation was based on what the researchers themselves call low-quality evidence. No one had ever really done a comprehensive review pulling all the data together to see how well a strategy actually works out in the real world.
So, at the end of the day, policymakers and healthcare workers on the ground needed a clear, evidence-based answer. Does going into the homes of TB patients and offering HIV tests actually find a meaningful number of undiagnosed cases? Is the effort worth the reward? That is exactly what this investigation set out to prove.
To answer that question, the researchers didn't just do a small study. They undertook a massive global investigation, systematically pulling together decades of research from all around the world.
They performed what's called a meta-analysis. The best way to think about it is like the season finale of a TV show. Instead of just looking at one episode in isolation, you bring together all the key plot lines from dozens of previous episodes to see the bigger picture. It just gives you a much more powerful and reliable conclusion.
And this really shows you the sheer scale of that effort. They started with over 3,000 scientific records. Then, after a really rigorous filtering process, they zeroed in on 31 crucial studies. This wasn't some casual glance. It was a forensic examination of data, covering more than 110,000 people.
And that brings us to the results. After all that work, what did the data actually show? Well, the findings can pretty much be boiled down to a few critical numbers.
First up, coverage. When health workers offered an HIV test during these TB screenings, nearly 73% of the people who were eligible accepted it. Now, that number did vary a lot between different studies, but it shows that, for the most part, people were willing to get tested. The opportunity was right there. Second, positivity. And this is a big one. Of all the people who were tested, a striking 5.9% were newly diagnosed with HIV. Now, to put that into perspective for you, many general population screening programs have positivity rates way below 1%. This number tells you the strategy is incredibly well targeted.
Okay, let's translate that positivity rate into something a bit more concrete, the yield. What this means is that health workers only needed to test about 17 people in these households to find one new, previously undiagnosed case of HIV. That is an exceptionally efficient way to find people who desperately need care.
And the strategy was even more effective exactly where it's needed most, in countries with a really high national HIV prevalence. We're talking over 10%. The positivity rate shot up to almost 10%. This shows that in the hardest-hit regions of the world, this method is an even more powerful tool for diagnosis.
The numbers are impressive, for sure, but they really only tell part of the story. To truly understand what this all means, we have to look at the human reality that's hiding behind the data.
So what this means in practice is that offering HIV tests to the families of TB patients, it's not like casting some wide, random net and hoping for the best. It is a highly focused, almost surgical strategy that targets a population where undiagnosed HIV is just disproportionately common. These households are a critical blind spot in our current approach.
But we have to remember that behind the 27% of people who decline testing, there are real human stories. This quote from someone who was offered a test, well, it just captures it perfectly. The shock of a TB diagnosis in the family can make it incredibly difficult to face another potentially life-altering test in the very same moment. It's not just about logistics. It's about psychological readiness.
And in fact, the qualitative data pointed to a pretty consistent set of barriers. People feared the diagnosis itself, of course, but also the stigma and the gossip that might follow, especially with testing happening in their homes. They felt unprepared, they were influenced by whether other family members agreed to it, And sometimes, just getting to a clinic was a major inconvenience. These are the real-world hurdles we have to figure out how to overcome.
Look, a good analysis is an honest one. So it's just as important to understand what this study doesn't tell us as what it does. Let's get into the fine print.
Now this, right here, is the most critical distinction. The study provides incredibly strong evidence that this is a great way to find people with HIV. But it gives us very little data on what happens next. See, finding a case is only step one. The ultimate goal is getting that person into care and on to life-saving treatment, and the study just couldn't measure that outcome.
And we have to keep a few other things in mind. This data comes from well-funded research projects, not from under-resourced everyday public health programs, so these success rates might be a bit optimistic. The vast majority of studies were from Africa, so we have to be careful about applying these findings everywhere else in the world. And finally, there was really no information on whether people were connected to prevention services, like PrEP, the medication that can prevent HIV infection in the first place.
So, after weighing all the evidence, the powerful findings, and the really important limitations, what is the final takeaway? What's the bottom line? The bottom line is this. The evidence is now stronger than ever. Systematically offering HIV tests to the household contacts of people with TB is a high-yield, efficient, and targeted public health strategy, and it is being massively underutilized.
We have the data. We know this works. The scientific question, for the most part, has been answered. The real challenge now isn't one of research, it's one of implementation. How do we actually fund, staff, and sensitively carry out this strategy on a global scale? That's the question this evidence demands we answer.